So hello, everybody. This is Joyce Graff. I'm with The Powerful Patient, and I have a very special guest today with me, Dr. Swannie Jett, who is the director of the Public Health Department in Brookline, Massachusetts, where I live. And we have a pretty impressive curve that I can show you, the classic bell-shaped curve that we've managed to bring COVID right down. So this is the classic bell-shaped curve. You know, we started off, we're adjacent to Boston, so we had some of the earliest cases. We hit a peak in April, and we brought it way down. And I think a lot of the credit goes to Dr. Jett and his staff. So I wanted to share with you how a community like ours of about 60,000 people has managed to keep COVID pretty much under control. So greetings, Dr. Jett.
Hey, thank you for having me.
Great. So I understand that you've got quite a few years in the business of public health in Florida and Kentucky as well as here. So tell us a little bit about your own background.
So, I would say I have fallen into public health sort of back door. My background is mainly environmental and agriculture engineering. And I started working at local health departments in the late 90s. And I have worked in, probably every department of a health department. And I became a health commissioner in 2009 in Bullitt County, Kentucky. And, I always wanted to be at the forefront of public health and sort of progressive. One of the things I noticed very quickly is that public health, we were very reactionary. We didn't put in a lot of preventive measures. I'm school trained at University of Kentucky in public health. And so they always told us to take risk. And so now being in Brookline is a community is heavily invested in public health. They're very astute. We have 8 to 9 public health schools around. And so the expectation is different. People expect us to be progressive and advanced, and I appreciate that. So our work to COVID really, is the acceptance of people, of my ideals and the department's ideals. Because some of my ideals probably wouldn't have been as wanted in other parts of the country.
So we responded pretty rapidly. I was very impressed that you got some good guidelines out there very quickly. One of the things that impressed me was the signs on the walking crossings of the streets that said, "Don't push the button," because at the time we were worried too about surfaces. And you even thought about telling us not to push the button, and all of those went on time sequences. So tell us some of the other things that you did to try to get the community well informed and get us all enrolled in the program.
Well, I think one of the major steps is, once we close business, all non-essential business, I noticed a spike in cases at essential businesses being open. And so that was alarming. And so me and my assistant director at the time, Pat Lundy, said, well, what can we do to reduce the burden on those businesses and stop the spread of disease? And so I said, well, let's go ahead and pass some type of ban on people not being able to show up without a mask in these businesses. But the only way we can really enforce it is to ensure that the businesses actually adhere to it and we can find them. So we didn't concentrate on the general public, we concentrated on the business, and we hope that the business would enforce it for the general public. And I think by including signage, we immediately saw a drop in cases because it really was scary in the beginning because there was a few businesses that thought they might need to close at one point, such as CVS and Whole Foods, because the cases began to grow. And it actually was customers coming in, I can see them coughing and sneezing, they were sick and they were making the employees sick. And so employees had a lot of concerns. So the messaging forward up front, that probably saved us a lot. The next part was requiring that all citizens wear a mask. And actually, it was the greater community that alerted us that citizens were not wearing masks. And
Mhm.
so we realized very fast if we were not going to find people on the street, that we had to have a serious education campaign. Um, we knew that we had to post up signs everywhere. So we wanted to make sure that we had them at the playgrounds. We actually, asked local business if we could put up signs. The transportation department, the rec department, parks and land use, they actually helped us with a lot of distribution and a lot of volunteers in the community. So it became a great, probably one of our greatest educational efforts ever in Brookline in terms of getting something out and having assistants actually to look at it and adhere.
Right. I know that I heard you speak at another forum where you said you had to learn to be belligerent. Tell me about this word you
So,
made up.
so it is actually vigilant, and that's being vigilant and a villain at the same time. So, to get messaging out, you had to get it out in a very vigorous way. And you had to be vigilant in order to get it out quickly and sometimes do it in a villainous manner so that people understood the seriousness of the situation. I remember early in this, I had a mitigation plan designed for Brookline that if we reached a certain amount of cases, that we were going to close the borders of the town, which would have been very hard to
Mm,
do. But
right.
we actually looked at 70 different arteries if we wanted to create the bubble so that people couldn't come into Brookline and spread it. Um, that was probably the extreme case. Um, but I think Brookline has responded, and I still receive emails of people not wearing masks, sometimes workers not wearing masks, and that allows us to be able to respond quickly. Looking at the data, we could see trends, and that was the good thing about this. Even though it was painstaking at first, but the health department, we actually tracked our own cases, and I was doing a data analysis myself, and so I could see what was going on in the community every day.
So you were actually able to identify these spreading hubs because of the contact tracing that you were doing. You
Correct.
converted, I heard you say once that you converted all of your staff to become contact tracers.
That's correct. So when we shut down the health department operations, everybody became one, and we did the same thing. Because at first it was just myself, a nurse, and one environmentalist, and that wasn't enough. So I learned pretty fast. One weekend, I had to quarantine 13 people by myself, and
Wow.
it took about 4 hours to do that, and it was a Saturday. And when I arrived to work on Monday, I said something has to change. Something has to change pretty fast because I said we're in trouble if we continue this type of method. And so, I mean, staff was very accepting, and we learned quickly on what to do. And then once the schools shut down, the nurses volunteered, and they became part of the contact tracing team. And I think by having that many people on the ground assisting at the same time, I was able to see the ebbs and flows and quickly contact people if somebody was exposed or became sick. And to me, that was the key.
So you had to start from these are the cases, these are the people who present with the symptoms and have been identified as having COVID. Now we have to find out where they got it from. And so sometime in the last 2 weeks, where did they go, right? Because it could have been 2 weeks ago that this happened, that they got it. So you traced it back to, as you said, some of the stores that were essential, like CVS, the pharmacies, the grocery stores.
Yeah, and being able to and understand. So, one of the key is my background is epidemiology. And so being able to understand the policy aspect, but also how we do contact tracing. And we did have some very difficult cases where it would take hours before we figure out exactly what was going on. And I would make site visits. So it wouldn't just be up to the staff. I noticed something was going on. I actually would show up at Whole Foods. I would do spot checks on Trader Joe's and I would talk to the management. So if there was concerns, because at one point all the staff was doing contact tracing, and me and Pat Maloney, we would do the site visits and do the inspections.
Mm-hmm.
So we understood the danger of it, but also by being able to do the site visits and the contact tracing, we also understood what policies need to be in place. So it had to be a two-pronged approach in order to be able to be successful. So we couldn't just do the work, we had to pass the policy to support that.
Right, and you're working with the businesses, not only protecting the public, but also protecting the business, because if their staff all gets sick, that's not good for business either.
No, one of my major concerns, I remember in the beginning, we have these essential business open. And I was thinking to myself, what a shame if they would have to close. And, people need medicine or food and, they close for 30 days. So we did our best to try to, and because there was so few essential business, I remember early in the pandemic that Trader Joe's averaged probably about 20, 30 people in line every hour.
Mm-hmm.
So the lines were very long, and we would do spot checks to make sure people had masks on and with social distancing. But we couldn't afford those businesses to close.
Right.
So we had to make sure that the workers stay safe and they practice sort of the policies that we put out.
Right. So stores here are a lot smaller than people in rural areas would see. I mean, you go into a Walmart or a store like that in the suburbs, it's huge. It's like a warehouse. But in Brookline, we don't have that kind of real estate available to grocery stores. So they tend to be a lot smaller, which means that they have to control the number of people who are actually in the store at a time in order to keep them apart. So they have one-way aisles. So you drive down one aisle and back the other one, like one-way streets in a big city. And they also had to set up lines outside the building so that people could wait in line 6 feet apart.
Yeah. And also we open up public ways so people can have some distancing. And so they could be 6 feet apart, not just the line, but there was a 6 feet pathway between them and the next person that might be walking down the street. So we had some unique challenges because, Brookline is heavily dense, and especially around some of the compact areas of Coolidge Corner, it created some concerns.
So you widened some of the sidewalks, took over more space outside of the buildings in order for people to be able to pass each other without going out in the street.
That's correct.
Right. I noticed as we've begun to open some of the restaurants for a takeout for outside food, that they've taken over some of the parking spaces and created little places for tables where there used to be cars parked. I presume they had to get permission from you and from the town to do that. So.
Yes, it actually was through building department, transportation, and my department in the application process. And actually, I think it's a good idea. I've seen other communities, such as Providence, do this. It's easily done when you can block off the entire street. But unfortunately, Brookline is very condensed, and there's not a lot of room. So the challenge is to make sure there's enough space for people to walk. ADA accessibility, and then parking is always
always a challenge.
is always a challenge. So to use parking spaces up for outdoor seating didn't make some people too happy.
Right, but I noticed that Zoftex has taken over a piece of what is the playground for the next door school, right?
Yes,
And Hamilton's restaurant took over some public space on the way to a parking lot, I think, behind them.
yes.
So people have been getting pretty creative, which is nice to see.
Yeah, it is very nice to see. And it probably will, a lot of them have more people too, rather than inside, outside. Because, one thing we don't want business to close for not being able to have clientele.
Right. We want the businesses to survive. We love all our little stores around, but it's
Yeah.
challenging in these times. Tell me about testing too, because I know you've done a lot with uh, making sure that there's enough testing here. Tell us about that.
Well, I wish I have done more. We have done actually just antibody testing, and we have worked with Physician One to actually offer COVID testing. But in an ideal scenario, we would have more sites where we would have ongoing testing for not just people with symptoms, but asymptomatic. The challenge with testing is making sure that there's a payer stream for that. Most health insurance are paid for symptomatic people, but not for asymptomatic. And that's the challenge that we face in Brookline. That's going to be the challenge to maintain schools open. And I applaud the universities that Boston U and DC that are going to do ongoing testing even for asymptomatic. Um, but we have done antibody testing, and we only had 7% people in Brookline that actually tested positive for the antibodies. So that means we still have a long way to go in terms of more people contracting the disease, which is good and bad.
Hmm.
Because I mean, 93% of the population has not had COVID. And so the disease is actually an opportunist. And so you can expect more cases the more we reopen business and schools.
Right, right. So you're working with the school system to try to open things safely. Can you tell us the status of that?
Well, I do know that they're bringing back deep and kindergarten. And I believe they're going to try to do it outside. I think they're still trying to figure out ways to do some type of air purification inside the school system. But there's some unique challenges. Some of the things I suggest is to ensure that if you bring kids back, only bring them back for half a day, and do it 2 days a week, and the other days do it remote. So that if you brought kids back and it was outside, it was safer at least until October, November,
Mm,
or do a phased-in approach until you figure out a way that you can safely bring kids back into the school system. And then, bring kids back in cohorts. So, we sort of gave them the advice that, do as much as you can to keep masks on kids. Um, but that's going to be a unique challenge. I've
mm,
seen very few kids keep a mask on for a long period of time. In fact, most of the people that don't wear masks, and if you look around Brookline, it's probably kids.
mm.
So, to bring them back in school, ask them to sit in the chair for 8 hours, have plexiglass on the desk, it's probably not feasible. It's probably more feasible to have air purification systems or something to kill pathogens. And then, doing the preliminary things such as making sure your kids don't go to school sick. If they have any symptoms, mainly reported, keep them at home. And make sure you don't give them medications to reduce the fever in some of the school. As some of the teachers would say, don't drug and drop them.
You mentioned cohorts, and that made me think in the early days there were issues with some of the policemen or firemen getting sick. And then if one person gets sick, then with the contact tracing, you have to say a whole bunch of people need to isolate. So I think you did some work with creating smaller groups, cohorts of police and fire people. Can you tell us a little about that, please?
Well, I think, at the time, Chief Lipson came with the idea, and we had a brief discussion that maybe you shouldn't have two people riding in a vehicle. And maybe if you show up at a scene, especially like for the fire department, and if there's a fire, maybe everybody doesn't need to go in. Or if there's something and they have to call fire and ambulance, maybe you only send in one person and you bring people in as needed. So some of those conversations earlier was trying to minimize the amount of exposure a person may have. So just in case one person became ill, it didn't knock out 10 people at a time and cripple your agency.
Right.
And so, they was very acceptable. We talked a lot. It almost seems like it was last year, 2 years ago, but we talked about this in early March. And
Right.
most of the intricate details I have forgotten about now.
But I think the schools were closed, and so as I recall, the police took over some of the rooms in the schools so that they could have smaller groups of people working in bigger spaces and keep them apart from each other. So as you say, if one person got sick, maybe 2 people or 3 people went out and not 10.
Yeah, the challenge was reducing the amount of, so if one person got sick, you didn't have 10, you only had 2. And then, making sure everybody had masks on.
Mm-hmm.
And, practice social distance as much as possible. And I think the police, they did it quite well. Didn't have that many cases. In fact, I don't think they had probably a few. Fire department had a little bit more, but, they're around each other 24/7 when they're on shift. And so that presents a different type of challenge.
So lots of different kinds of challenges and different kinds of responses were required as we went along. It sounds like you had to constantly make up new answers to meet the new challenges.
Yeah, that's correct. But I pretty much tried to keep everything simple and, ensuring people were masked, social distance. If they were sick, because it was easy to identify people that were sick. And if somebody was asymptomatic, you still don't see, even though some research shows there's a lot of people may be asymptomatic. But I really haven't seen that in Brookline, and people have been spreading it. So that's the fortunate thing. And even if one person in a household does get COVID, it hasn't spread it to every member of the house. So that's been, a few times, but not all the time.
Mm-hmm. Good. Yeah, we had several professionals who went to the big Biogen meeting that was in Boston in February, that became a spreader event. And I remember a friend of mine whose wife went to that meeting had isolated himself from us even in the early days of March.
Yeah, those were the first cases I received were from Biogen conference.
Mm-hmm.
March 11th on a Wednesday, I believe, I received 2 cases. And, most of the time their exposure was like February 27th, but some of them were exposed at the conference and then they went back to the office. So I got a second cluster from people that went to the office on March 4th. But it was just a bad idea. Actually, in Brookline, I foresaw some of this, happening because I was paying attention to China in December. But in January, we actually were quarantining people that was flying in from China and other places. So I knew that there was potential for it to be a very explosive, at least around New England area.
So looking back now, what would you say are the most important things for getting rid of an epidemic or a pandemic like this one?
Well, I said this in February, March. One of the first things I would have done, and this is probably my 3rd or 4th, pandemic, epidemic that I've sort of been involved in. So one of the first things I would have done would have been to close the borders. So I would have, stopped all international travel as early as February. Um, then I would have tested everybody. So once I would have tested everybody, then I would have, shut down everything for 30 to 45 days. And that would have allowed 2 cycles of the disease to um, pass through whoever's going to pass through. So 14 days incubation, and then if I figured if the second set of people got sick in a household, another 14 days. And then you could have reopened the economy. So it's ironic. I've been saying this since, February, March, and we still having this unique challenge. And so some of my ideas actually came from, I remember dealing with Ebola. And the first thing we did was stop international travel to West Africa and from people coming in and going out. And that immediately sort of stopped any disease coming into the country. We was reluctant to do that, and we didn't do it until March 11th. Well, by March 11th, pretty much everybody was in the country already. As I said, I've been quarantining people since January, traveling from Italy, China, and a variety of different places. So they traveled from January all the way to March. So at that point, the underbelly of the disease was already in the country. And then we never did any significant testing. So we didn't even have testing available until late February, early March. But by that time, it was too late. And then we had the confusion if it was flu versus COVID.
Right.
And then we didn't test people. So if you had mild symptoms, doctors were telling people to stay home. If you had severe symptoms, then, you came to the hospital and you were admitted.
Right.
So, the entire approach and how to deal with infectious disease was botched from the beginning. And on top of that, when I was considering doing a mask mandate, it didn't make sense for Brookline not to do a mask mandate. And the signal was, I remember, and that's the experience of working, uh, you know, pandemic or infectious disease. During Ebola, I wore a mask anytime I interviewed somebody that might have been suspected of COVID, of Ebola.
Ebola. Yeah.
So why wouldn't I do that for COVID?
Right.
I didn't have the disease, but they possibly had the disease. So I wore a mask to protect myself. The messaging that came out of CDC was, if you asymptomatic, you don't wear a mask. Then the messaging was, well, asymptomatic might be spreaders.
Mm.
So everybody needs to wear a face cover. And I say, it don't make sense. Let me just go ahead and require people to wear masks. And
Yeah.
then we talked about it just being an air droplet form. But I'm like, it's spreading too fast just to be an air droplet form, especially in tight spaces, in buildings, in nursing homes.
Right.
So it has to be some aerosolized possibility for COVID. And so, I just read the science of what was going on and talked to people and based our decisions, upon that. And the Advisory Council on Public Health, we both had, debates or talked about the research and had public hearings about it. And so a lot of our decisions was based on the science and trying to get ahead of it. And when you talk about the bell-shaped curve, that had a lot to do with our decision making and making sure that we bent the curve a lot faster than other communities.
Right. Let me ask you too about, everybody's asking when will we have a vaccine that we can look to try to help us quell this pandemic. But part of having a vaccine is the public acceptance of a vaccine, and the other part is the delivery of the vaccine. And I know I'm part of the community emergency response team and the Medical Reserve Corps, sets of volunteers that work with public health. And so I know that you already have in place a scheme for distributing some sort of inoculation. So can you talk a little bit more about your issues, your plans for dealing with, once we do have a vaccine, how we get it out to the public?
Well, you know that I think that's the easy part. So, you know, we would set it up like dispensing centers. And we probably have, you know, just like we do with flu, we probably have a few of them around the
Yeah,
town,
yeah,
and have it where people would drive up, just like we did with the antibody testing. Have people drive up and be inoculated that way, and then have a site where people can walk up and do it. I think the key to this, and I saw this in dealing with H1N1 when I was a health commissioner, is, you know, how much of the vaccine we would get.
mm,
I think people would be very acceptance of it. I remember, I think it was 2010 for H1N1. Um, you know, the surrounding towns, I remember, did not want to give the vaccine out because they wanted to stockpile to make sure they can inoculate, you know, the entire community. I opted to give out the vaccine as I got it.
mm-hmm.
And I had 1,200 people in line waiting to get the vaccine. This was sort of new for H1N1.
Yeah,
And it wasn't as dangerous or as deadly as COVID. So I think, you know, the wider community, you know, there'll be acceptance of it. You know, efficacy has a lot to do with it.
sure.
But I always say, even if you know, get a flu shot, for instance, and it has only 60% efficacy, I would rather have the flu shot than to have the flu.
Yes. I had the
So,
Hong Kong flu in the 60s, and I was
oh,
flat on my back for a week, which is not me. So
yeah,
it was one of the worst illnesses I've ever been through.
yeah,
So, yes, I would much rather have the shot than have the flu.
yeah. So, you know, one of the things we will, of course, alert MRC and work with emergency management. And we would set up different distribution sites, you know, where we can inoculate people. And I don't think it'll be a one-time deal. It'll probably happen over a week, depending on how much vaccine we have in.
Right, right.
And then we go for that.
Yeah. Well, thank you so much. I feel relatively safe here, and my son is immune compromised, and I'm 76. So we're both high risk, and I have to say that I feel very comfortable that we're doing a wonderful job in Brookline, and much of that is thanks to you. So thank you.
But thank you. I appreciate it. And you have a great day.
You too.
All right. Bye-bye.
Thank you.